This is Aaron Rice, your host for Maryland Climate Tech 2026. I am here with my good friend Dustin. Well, we're new friends. Dustin, go ahead and introduce yourself. Let people know who you are, where you're from, and what you do.
Yeah, nice to meet everybody. Yeah, my name is Dustin. Yeah, we started the company called uHoo, and what we do is environmental intelligence. We help you understand the quality of your environment indoors, and from that amount of data and insights, we help you change your behavior so that you would be able to create a space that is healthier for you and also more energy efficient for you.
Got it. Okay, so
Yeah.
environmental intelligence. Okay, I love that. I love that. We call those smart, healthy, high performance homes.
Mhm.
And where are you based?
Based in Singapore.
In Singapore.
Yeah,
Okay, all right. So
yeah,
we've got some international talent here, folks. Well, I'm glad that you made time for us to have this chat. And the reason and the way that I met you was I was doing some research on the Reset website. I'm a Reset accredited professional, one of the first and only ones here in Maryland. And I decided I wanted to reach out to some Reset accredited monitor, makers or developers, the people that were actually making the hardware. And I reached out, and you were nice enough to accept the invitation to come and present. So I appreciate that. Talk a little bit about how long the company's been around, like how did you come up with the name YooHoo, and a little bit more of the backstory.
all right. Yeah, so where do I start? Yeah, so we started the company in 2014. This came out from a an ailment that we needed to solve. So my co-founder's name is Brian. Both of us were doing our MBA in Hong Kong. And when we were there, we would often get our allergies. I have allergic rhinitis or hay fever. My co-founder Brian has asthma. And whenever we were in school, we would often get sick inside the school buildings. And
Mm,
when you walk out of the school buildings, we feel better.
mm.
And it's the same case for a majority of the students. So the school didn't really do anything about it, although we told them that it didn't feel comfortable inside the buildings. And that's when we decided we need to address this ourselves. So we dropped our classes and started the company. And it took us a few years, 4 years, to build our very first product. We launched a residential product in 2018. And eventually we transitioned to developing and releasing an enterprise solution in 2022. Yeah, and that's how we started growing the company. And
Got it.
just a few months ago, we launched a second generation of our residential product.
Oh, wow.
Yeah.
Congratulations. So, one of the challenges, so we've got what we call a trifecta of challenges here in Maryland. One is that, Baltimore City has the highest rate of asthma-related fatalities in the United States. So we've got a big asthma problem here. African American women are 4 times more likely to die from asthma than white men here in Baltimore, and African American children are 6 times more likely to die than white children here in Baltimore. So it's a really big problem here. Another problem we have in the state is radon. One in
Mm,
four homes here in Maryland has radon levels above the EPA levels of 4 picocuries per liter above the action level. That's how I come to the space is discovering radon in my home here in Randallstown, Maryland. And I was
mm,
reading Dr. Joseph Allen's Healthy Building book, which I'm sure you've read,
yep.
and he talked about radon coming from granite countertops. And I was like, oh no, we just renovated our kitchen and put in granite countertops. So I went ahead and got a monitor. I got an Airthings monitor at the time, and lo and behold, we had very high levels of radon, 15, 20 picocuries per liter, and that equates to smoking 20, 30 cigarettes a day, and we've been here for 25 years. So we've since got it mitigated, but I totally geeked out on radon mitigation, radon systems, air quality monitoring. You know, pursued that into becoming a reset accredited professional. I'm a real estate agent as well, real estate broker here in Maryland. I
Okay.
have been for 25 years. So, I'm in buildings and homes all the time, but if you don't measure it, you don't know it's there, right? And what
Exactly.
what you're measuring and what I'm measuring, you can't see, smell, or taste. So,
Mm,
but we'll do some damage. So it's really cool to hear that this is you created a solution based on what was happening in your own life, and it really resonated with you in that regard. So this wasn't some sort of something that you were doing just because of COVID. So how did COVID influence positively or negatively the growth of your business?
COVID had very different effect. I'd say that the case was it put air quality at the top of people's
Hmm.
minds. Prior to that, people didn't really care
Hmm.
about the air that they breathe. But when COVID struck, we launched the uHoo virus index. So we were the first in the world to be able to detect coronavirus risk in real time, transmission risk and survival risk of the virus. So that pushed the adoption of our solution very well, especially in the enterprise sector, not so much in the home sector. Yeah, I guess it was more a case of being able to market it properly and getting visibility. But on the enterprise sector, we were able to do it pretty well. Yeah.
Yeah, that's what I'm finding is that most of the monitors and the companies that I engage with, and even the building certifications, even Reset is designed for,
Mm,
kind of commercial enterprise level.
mm,
They do a few certifications in residential, but it's pretty much an office, corporate, type of entry. But I think there's also an opportunity on the residential side, since there's so many more residential homes than there are commercial buildings, and most of the, greenhouse reduction and climate resiliency sustainability efforts are generally targeted towards the commercial side of the market.
mm,
In Maryland, we've got the most aggressive climate law in the country. It's called the Building Energy Performance Standard, or otherwise known as the Maryland Climate Solutions Now Act. So all of our buildings have to be net zero by 2040, and it seems like the market is just focused on energy, but rarely focused on the health and wellness of the building occupant. And so
yep.
I'm always that one that's kind of beating the drum in regards to, well, what about the health and wellness of the building occupant? Because, I take my monitors, I've got some mobile monitors that I take with me everywhere that I go, hotels, planes, trains, you name it.
Mm,
And I've been into net zero buildings, LEED, platinum, silver, gold, and they all generally perform horribly when it comes to indoor air quality, unfortunately. Unless you're monitoring it, right? So,
yeah, exactly.
talk a little bit about you do have reset accredited monitors. Talk a little bit about that process
Yep.
for people who don't know what that is like versus just, going on Amazon and picking up kind of the monitor that looks like it should do okay. What's the difference in your opinion?
Yeah, the difference mainly is reset accredited monitors have been tested for its performance.
Mhm.
So the data that you get is actually reliable. And of course, if it has something to do with your health, you want reliable data. You don't want to just pick something off the shelf that has no certification, no accreditation, and then you rely on that for your health. That's not really a good decision because you may be getting wrong data and then you make the wrong decisions. So it's really important to find a product that's properly accredited, properly tested, and yeah, internationally known.
Yeah, absolutely. So third party accredited and validated hardware and third party accredited
Yes.
and validated data as well, which is also very important.
Yes.
So you're
Yeah.
not, and this is why, LEED version 5, if you want their air quality
Mm,
points, you need to get a reset, accredited monitor.
that's correct. Yeah.
Fitwell also have crosswalks with reset as well.
Mm,
I first heard about Reset in Dr. Joseph Allen's book. I mean, that book really changed my life, and really become a huge advocate, especially like I said, finding radon in my home here in
mm,
Maryland. So how do you when you're out in the field or your team is out in the field, trying to make the business case when a building owner or a homeowner talks about return on investment, payback period versus something that's easily identifiable. The payback period for energy reduction has been established for many years, so it's
mm.
easier to kind of make that argument that this is what you should be doing. How do you make that argument on the indoor air quality side about, payback period and return on investment?
Yeah. So it always goes back to compliance and also ESG because energy is very clear. It hits your P&L.
Mm.
But the way we work with our clients is we hit valuations, wherein valuations is actually a much larger return on your investment compared to just the P&L. Because if we help you secure, let's say, the LEED certification and the WELL certification simultaneously, then you can see an uptick in the valuation of your property. And that type of uptick is much, much larger than energy savings that would hit just your P&L. So that's usually how we work with our clients. That's one aspect. The other aspect is we really look for internal champions who look at well-being as a core of what their company stands for. So that's on the enterprise side. When we talk to residential customers, it's very easy. Let's prevent your next asthma attack.
Right.
If your asthma attack will cost you $3,000 for the medication, why don't you just spend $300-$400 on a solution that helps you prevent it?
I mean, yeah, in the States in our area, it does cost the average household between $3,000 and $5,000 annually just to manage all the apparatus that you need to manage the disease.
Yep.
Let alone if there's, an emergency room visit, that's $1,000. And if you get
Mm.
admitted overnight, that's the most expensive, overnight stay you'll ever have at about $10,000. And so that's
Yep.
another problem that we have here in Maryland. So we've got the longest emergency room wait times in the country as well. And so these are all preventative. And if we're talking about asthma, these are all preventative things. And it's almost, the industry, the healthcare industry has gotten to the point where, it's kind of a perceived failure if someone's actually coming to the hospital with an asthma, related emergency
Yeah,
that could have been resolved inside the home environment. So,
exactly.
so talk a little bit about your monitor. What type of sensors do you have? Do you have radon sensors inside of your monitor? What are you measuring exactly?
Yeah, so we have two types of monitors, one for the residential and one for enterprise.
Okay.
For the residential, we measure 9 parameters. So that would be temperature, humidity, air pressure, CO2, carbon monoxide, VOCs, nitrogen dioxide, ozone, and PM 2.5.
Oh.
So that's for the residential monitor,
Hmm.
9 sensors in one device.
Hmm.
And for enterprise, it's 13 to 16. The
Wow.
reason why we say it's 13 to 16 is because we designed the product in terms of modules.
Hmm.
So you can actually add on sensor modules into it. And the base 13 parameters would be temperature, humidity, air pressure, CO2, carbon monoxide, formaldehyde, VOCs, PM1, PM 2.5, PM4, PM10, light, and noise.
Hmm.
And you can choose up to 3 more from nitrogen dioxide, ozone, sulfur dioxide, hydrogen sulfide, ammonia, and oxygen.
Wow.
So we have 6 specialized gases, but you can only fit 3 into the product. So you can choose up to 3 more as an upgrade to the base 13 parameters.
So it sounds
Yeah.
sounds like you cover the nine foundations of a healthy building that
Mm.
Dr. Joseph Allen talks about. We talk
Yes.
about light, noise, and
Yep.
those types of things. Wow, I haven't. I need to do more research. I should have done more research. I didn't know you covered that many things. I didn't know it was possible with one monitor to do that much. So, if someone, do you is radon a thing in your market? Like I said, it's definitely a thing here. Could if somebody wanted to add a radon module, is that possible?
No, it's not possible. It's
Oh.
too big to fit inside. So that's why we could not add it in as an optional upgrade.
Hmm.
Yeah. Yep. So
So,
radon is not part of the scope.
okay,
Yeah.
okay. You're also the co-chair of the Global Commission on Healthy Indoor Air. Congratulations.
Thank you.
Can you talk to me a little bit about how and why that organization started, and what is the mission and the vision, and kind of what's it all about?
Yes. This organization was started by IWBI, basically the one that certifies you for well.
Mhm.
And they invited a number of individuals to co-chair the commission. And the whole purpose of the commission is to come up with a framework that countries can utilize to develop their own regulations for indoor air. So you can think of it as like a WHO
Mhm.
that's focused on indoor air quality.
Mhm.
We help design the framework. And once the framework is designed, countries can adopt it for their own use and make tweaks based on their own local
Mhm.
environments. Yeah. And the whole purpose really is we want to drive regulation into this because that's the only way for us to really force indoor air quality to be healthy.
Yeah, yeah. So I love it. I love that. Congratulations on your co-chairman and commissionership of that. I'm excited to follow what the
Thank you.
International Well Building Institute is doing in that regard, and they're huge supporters of our events as well. And whenever there's a Healthy Buildings Summit or Policy Summit here in the DC area, I'm always, kind of in the front row kind of absorbing as much of the information as I can. So they're doing great work in that regard. And so, you know, I don't know, Guy, if you've been watching the news, but we've had some pretty dramatic legislative things happen here in the States. As of today, the Environmental Protection Agency has pretty much written out or canceled a lot of the greenhouse gas reduction measures that and climate change measures that has been monitored over the last 30 some odd years by the Environmental Protection Agency. So that's creating a challenge and maybe an opportunity at the same time because there's also, this push for, making America healthy again, right? And a push
Mm,
for indoor air quality and health and wellness of occupants. And so there may be an opportunity there. And I love the fact that you're doing it at at the country level. We've had, medical institutions, John Hopkins, made a push to get indoor air quality, regulations or standards of law or laws. And folks, there is no indoor air quality. There's no federal indoor air quality mandate, law, rule. There's just suggestions, right?
yes.
Um,
Suggestions. That's
there's,
all. And it's hard to implement if it's just suggestions.
right.
Yeah.
It's like the speed limit. It's just a suggestion.
Yeah.
But because we spend so much of our time indoors, 90 to 100% of our time indoors, and indoor air quality being up to 100 times worse than outdoor air quality, there really needs to be, like there is for outdoor air quality, some sort of regulation involved. And so I love the fact that you guys are doing it at the global level. Um, and so from what I saw, this just kind of came together maybe in September in the fall of 2025, or how long has it been? Um,
Yeah. I think in September during the UN Climate Week in New York.
okay, okay,
Yeah.
and
That's when it was launched.
okay, and so can you talk about kind of where it's going? What are some of your initiatives, some tactics, and things that you guys are
Mhm.
looking to do? Do we need to sign an NDA to get this information, or is it all publicly available?
Uh, I'm not sure if it's publicly available, so I'd rather not say
Okay,
what we're
okay.
doing right now.
Okay, okay, okay. But folks know that there is an organization, a global organization. I'm
Mm,
speaking to some represent Jessica Bantam is here in my
mm,
region, so we're talking to her as well. So we've got local representation here in in the DMV. And it's a very diverse panel of subject matter experts as well. So that's great to see. And so, talk to me a little bit about kind of in regards to your organization, where do you see it going for 2026? What are you most excited about? What changes are you seeing? Like, how big is your organization and kind of what direction are you guys going in?
yeah, we're still an early stage technology startup company.
Okay.
So where we see going is really capturing more locations from our enterprise clients.
Mm.
So we usually start with one location, expand to more sites that they own or that they operate in. And we're also very excited with the new residential product that we launched. It's
Hmm.
called the uHoo Kaylee, and I think shipping starts in May,
Okay.
sometime there. Yeah, so we're doing pre-orders right now, and that would be really a game changer in the residential market
Hmm.
because of how we designed the sensor and the product, and also the experience in the app. Yeah.
And so yeah, talk a little bit about the app experience.
Mm,
The experience that I have is, when I'm cooking, I get a
mm,
alert on my phone that my PM 2.5, my particulate matter PM 2.5 is spiking.
mm,
And we have a what we do here in Maryland, we have what we call a 30-day healthy home checkup. And so we're
mm,
deploying, we got a small grant from a local utility company, and we deploy monitors in homes for 30 days. And then, we connect them to the residents' Wi-Fi, and then we have a
Hmm.
central location where all the data comes in. So if radon spikes or particulate spike or CO2 spikes, we can immediately text the occupant and say, "Hey, your CO2 is
Mm.
spiking. Kind of what's happening? What are you doing? Are you cooking? Are you cleaning? What's happening? Maybe crack a window, right?" And so we can kind of suggest
Yep.
low to no cost mitigation strategies for that.
Mm.
But so do you envision kind of, I know some sensor companies are also developing air purifiers as well that have some sensors in them. Do you envision doing air
Hmm.
purifying as well?
No, we don't
No.
envision doing that.
Okay.
Yeah,
Okay.
because the whole idea really is we want to separate the sensors from the purifiers. We want independence.
Hmm.
So
Hmm.
if you're a sensor, if your company does purifiers,
Hmm.
if you want to do sensors, you want to do it separately. Don't put it in one device.
Right.
It's the same. If you're a sensor company, you want to do a purifier, make sure it's separate.
Hmm.
Because the whole idea is if your sensor is on your purifier, your sensor is detecting the air that's being clean, that's already clean, right? So the likelihood of it detecting the polluted air is lower. And proper positioning of the sensor is really important.
Right.
Where you deploy it inside your room.
The
If you
breathing
don't
zone.
deploy it
Yeah.
properly, you're not going to be able to capture it properly. And if you put it inside a purifier, it's going to restrict where you can deploy it. So we
Hmm.
always suggest that it's always better to have it separate.
Hmm.
Yeah.
And as far as that's a great point. And as far as because when I go into spaces and I see air purifiers, I always ask the question, like, how do you know it's working? Like I know the blue light is on, the green light is on, or whatever, but and I know I
Yes,
can hear the
exactly.
fan, but how do you know it's actually doing what it's supposed to do? And it's one of those things
Mm.
that unless you monitor and validate, you don't know,
Yeah.
unfortunately. So
Yes.
uh, so going back to your residential monitor that's coming out, are you currently deploying both your enterprise and residential in the United States market, or is it just in the European Asian market?
Yeah, where we have a number of clients in the United States. Majority of our residential clients are actually in the United States. Yeah, we
Oh,
have our own warehouse there as
oh,
well. So
okay,
when we ship to our US clients, we ship locally from the US.
okay.
Yeah,
And
especially for the residential.
where's your
Yeah.
U.S. Warehouse located?
In Ohio.
In Ohio. Okay,
Yeah.
okay, great,
Yeah.
great. Well, hey, I'm glad we're having this conversation because it gives me exposure. I just been using kind of one monitor, one brand that I found I liked,
Mm,
and kind of
mm.
stuck with. I would see it in the background of Joseph Allen's videos. I was like, okay, well, it's got to be the good one. Um, and just kind of stuck with it. So I'm glad we're having this conversation. I'm learning so much about, kind of the ethos of your company and the
Mm.
the you know the mission and the vision and the different things that you're monitoring, which are exciting. Um, I'm always wanting that radon sensor though, but I understand why it's not there. There are other alternatives for that, but you are monitoring so
Yep.
many more things. Would you say that your platform is more of an open sourced, or is it kind of a closed ecosystem, or can people like build your monitors if they wanted to, or how does that work?
We develop our own monitors and our own software. So
Okay.
when people buy it, it's really complete already.
Hmm.
And we can integrate with the new generation residential product. You can integrate it with uh, Apple Home, Google Home, Alexa, Home Assistant, basically anything and everything already. Our first generation does not. Yeah.
And the residential app, what are some of the standout features with the app? What does it do differently maybe than maybe some other apps that come with different air quality monitors?
Yeah, the standard ones would be displaying the data, showing the trends over time, the charts.
Hmm.
Something that would stand out would be the indices that we developed. So
Hmm.
that would be the virus index. We also have a mold index, and we also have an influenza index. So
On the
we are able
residential
to
on the
detect all
residential
of
unit?
these risks in real time.
On the residential unit?
Residential, yes.
Oh, whoa. I'm a
Yes,
fan.
that's correct. Yeah, our enterprise has those three plus more indices as well. Yeah.
Okay, okay, okay. All right,
Mm.
all right. And the The enterprise unit is the one that's reset accredited. Is the residential unit reset
Yes.
accredited? It is.
No.
Oh,
No,
it's
no. The
not.
residential one is not. The
Okay, okay,
enterprise is.
okay, okay,
Yeah.
okay, okay,
Mm.
okay, okay. I was like, whoa, I hit the jackpot.
Yeah. We had to do that distinction. Yeah. Because we want the enterprise to focus on the enterprise solution.
Yeah. And
Yeah.
the enterprise unit, do you need to have its own cellular, connection? Because I know in some, government buildings they don't want you tapping into their Wi-Fi network. So does it have its own cellular network, or kind of how do you connect the residential, or excuse me, the commercial units to without tapping into it?
Uh, yeah. So it has its own cellular connection. So there are three connectivity available for the enterprise: cellular, Wi-Fi, and Ethernet.
Okay.
And majority of our clients, they just use cellular because it's easy. Plug it
Yep.
in, press the power button. That's it. It's online. You don't need to do anything further.
Awesome. Hey,
Yeah,
Dustin, this has been great, man. I learned so much. We've never met before. You graciously made time for a absolute perfect stranger. So I definitely appreciate
my
that. But
pleasure.
I'm very excited about your product, and I will definitely keep you posted on kind of how things are happening with us here, and look to deploy some of your monitors as well. Do you have a mobile version, something that you could snap on a backpack, maybe?
And no, we don't have that one.
No. Okay. Okay.
Yeah,
Okay.
yeah. Our solutions are mainly permanent monitors.
Understood.
Yeah.
Understood. Well, Dustin, is there
Yeah.
anything that I didn't ask you that you think people should know?
Oh, no, I think it's pretty much complete.
Okay, great. Hey, I really appreciate your
Yeah,
time, and I look forward to meeting you in person at some point in the near future. And I appreciate your thought leadership and subject matter expertise in the space. And thank you.
yeah. Thank you for the session as well. Appreciate it.
All right. Thank you so much, Dustin. Talk to you soon.